This session is on transforming the economy for health equity and environmental sustainability. There's some really good speakers who've got a lot to say and a lot that's really important. Um, I just want to stress that everyone needs to, speakers as well as when we open it up to the floor, we need to try to keep within our time limits and put points across quite promptly, because if one person dominates the conversation, it means it takes it away from somebody else. So I'm going to be quite strict with moderation and trying to move the conversation forward. Throughout this conference, we've been hearing about the climate crisis being the greatest threat to humanity. We've heard about massive subsidization to the fossil fuel industry, crises in finances and the economy in other sectors. And we've heard about the current economic order being responsible for increasing inequality, loss of biodiversity, basically driving the climate crisis, and having a very negative effect on health. So there have also been some calls in the conference for a new economic order. I think this session is going to start unpacking various elements, and I'm not going to really say too much because I'm not the expert on this. People here are. We've got online somebody who's going to set the tone for the whole conversation or the whole session, and she is remaining online, so we're not going to open up for questions after she speaks. She will be part of the ongoing discussions. We then going to, that's Jayati Ghosh. She's a professor at University of Amherst in the USA. We're then going to have a conversation, and where questions are posed to the different panelists that are here, and I'll introduce them all a bit later. Jayati will also be part of that conversation. Unfortunately, one of the panelists, Ravi Duggal, has had flu, and he was going to be online, but he's lost his voice. So I'm going to put across a few of his responses because he sent those to us in advance. But if we can start with allowing Jayati to get onto the screen, and she will give the overview.
Hello, thank you very much. Can you hear me? Yes. Yes. Thank you. Well, it's a great pleasure to be with you, even if only virtually. I wish I could have been there in person. But I'm so glad that this stream of the conference is taking the issues of the economic architecture and economic strategies for health very, very seriously, because it is really time that we overturned the standard way of looking at health, which is so often we find this. We find this in the World Economic Forum at Davos. We find it in the international financial institutions. Health is talked about as something that is good for the economy. It's important to have healthy workforce. It's important to have health as something that delivers higher economic growth and better productivity. I really think, and I think many people on the panel probably share this view, that we have to reverse this. We have to start thinking of what the economy can deliver for health for all, and how we can ensure that the international and the national economic architecture and national economic strategies are directed towards ensuring that the people have a viable, healthy, sustainable life that allows them to achieve their capabilities in harmony with nature and the planet, because that is, again, something that we have tended to ignore when we focus on the economy. What's very important to remember is that this can be done. And I'm delighted to note that in this session, we'll be hearing from two people who have been very active certainly in considering specific ways in which this can be done. I know that Ritu Sadana is in this panel, and that's important because she and I have been colleagues in the World Health Organization's Council on the Economics of Health for All, which is precisely trying to do what I just mentioned, to reverse the traditional causation and think of the different economic strategies and approaches that we need to ensure health for all. And you have Sandrine Dixon-Declercq, who is the president of the Club of Rome. I have been involved with her in the Transformational Economics Commission that the Club of Rome set up. And we have recently produced a book, Earth for All, which is looking at 5 fundamental transformations that are necessary to actually achieve the planetary turnaround that we desperately need, that we cannot avoid any longer. So with this broad context, let me just highlight what I believe is absolutely necessary for the global economic architecture, that what has to change in that architecture, and how that should then permeate down to national and local levels, well, regional as well. I think it's fairly clear to all of us now that the international economic and financial architecture is not fit for purpose. It's not doing what it should do, which is to say the Bretton Woods institutions are not delivering what they were promised to deliver in periods of crisis, or in preventing instability in crisis, and in meeting major challenges that are faced commonly in terms of global common threats. And perhaps that's not surprising. They were, after all, created more than 75 years ago, and it is difficult to make institutions that would be flexible enough to actually meet the current challenges. But it is also the case that many of the promises and many of the articles of agreement of these institutions, the IMF in particular, are still relevant. It's just that they're not being put into practice. We are not utilizing several of the important elements of those articles of agreement. And that's really because of the stranglehold of, let's face it, a set of countries or a set of small, rich nations that have inordinate control over these institutions and their functioning. There is also, if you like, an approach, a basic set of economic principles that is no longer fit for purpose, which believes that relying on market functioning, reducing the role of the state in directing economic activity, reducing the state's ability to regulate private capital and to tax it adequately, that all of these are necessary for better economic functioning. That we know is also not valid. So we really need dramatic changes in these institutions to meet our challenges. We also need a change in the economic framework of national governments, precisely along the lines I've mentioned, to recognize that the economy has to meet the needs of people, society, nature, the planet. We do not need an economy that functions for its own good, that functions for the interests of a few very large corporate powers or a few very highly rich individuals. We need an economy that meets the needs of all the citizens and that delivers basic goods and services, delivers essential human rights, economic and social rights, and that does this with sufficient equity, sufficient equality of opportunity, as well as greater equality of outcomes. So what do we need to change? I think the first thing we need to change is the lack of flexibility when dealing with ongoing crises. Now, we know that the pandemic was one such crisis, and we know that we were unprepared. We know that we were very slow to respond, not in terms of public sponsorship for vaccine development, which was actually remarkably impressive, but in terms of the spread of knowledge, the essential dissemination that is required to make sure everyone in the world has access to vaccines. We know that we failed utterly in that. And we know that this is not because the WHO didn't make sufficient efforts, but because the international architecture, and particularly the intellectual property regime, prohibited or inhibited such extension of knowledge. So we have to revise that. It's not just a question of a TRIPS waiver. We now know, during the COVID-19 pandemic, we now know that we have to ensure that the TRIPS agreement does not become a barrier to further technology development and further technology dissemination, expansion of this knowledge to everyone who can produce in different parts of the world, to meet major challenges, to meet the climate challenge for green technology, to meet future health challenges, to meet even the current dealing with the therapeutics for ongoing health challenges. So we really need a dramatic change in the way in which we organize the control over knowledge and intellectual property. And that has to begin in the WTO with the TRIPS agreement. But we also know that the international financial architecture is hugely lacking. We know that the ways in which private capital is allowed to flow across countries can be hugely damaging. But we also know that then the global macroeconomic situation, and particularly the macroeconomic policies of the advanced nations, have a huge impact on the rest of the world. When they loosen up, then money is freely available, sloshing around the globe, liquidity in search of high returns, and it enters markets, and countries say, well, what's not to borrow when you get negative real interest rates? So they borrow, encouraged by the global institutions, in ways that are eventually unsustainable. That unsustainability has come to roost with the pandemic. And so now there are countries, at least 58 countries, according to the IMF, probably more, facing serious debt distress, on the verge of debt default. Yet the international community is incredibly slow to respond. So we have about 7 countries currently in debt default, many more unable to pay and figuring out what they can do, trying to cut down on all other expenditure, including health expenditures, so as to meet their debt service payments. And in a way, trying to deal with debts that we know can never be repaid in full. So clearly, we have to have major debt restructuring. We have to have a cut in debt. I would remind everyone this happens regularly for corporate debt. It's not something very unusual and crazy to demand. It's happening all the time in each of our countries for corporate debt. Banks are regularly writing off a huge amount of debt lent out, especially to private corporates. When it comes to sovereign debt, suddenly we say, no, we can't do this. It takes forever. Countries that applied for debt relief under a scheme that was set up by the G20 more than 2 years ago, not even one has actually got that debt relief. It's absolutely ridiculous what we're doing. And this cannot happen either, because this is going to actually create massive instability, certainly global financial instability, but much worse, huge political instability because of the major suffering that this is generating in these countries. And this will spread. This is not something that is going to stay in only one country. This has huge implications, as I mentioned, for health, because it inevitably means that there is a cut in the different kinds of investment that can affect health. We have to also remember, this is something in our WHO Council we have talked about a lot, that we cannot actually impact health without looking at the whole of government and all of the different kinds of investments that impact health. So investments on food, on sanitation, on nutrition, on housing, on all kinds of other things impact on health. You cannot say just the health sector, the health budget is all that matters. And we know that whenever countries face these kinds of crises, they engage in fiscal austerity that cuts down on such spending. So another area in which we definitely have to have change. We also have to have changes in terms of how we are dealing with the nature of financial flows and how they are currently operating in ways that actually add to the worsening of our planetary situation. Today, we know that fossil fuel subsidies still dominate. The IMF estimates that the total direct and indirect subsidies come to almost $6 trillion in 2020. Imagine what they are now after the Ukraine war. We know that these subsidies continue and have increased over the last year because countries have set targets that are so far away in terms of meeting carbon emission targets that they can do whatever they like for the time being. We also know that the money going for green investments is ridiculously small. Both public and private sources, it's a tiny fraction of the amount that is still going for fossil fuel investments. And that's because the incentives are skewed. We subsidize the fossil fuels. We do not adequately subsidize the green energy. So we are not getting that transformation that Sandrine will tell you about, the turnaround that we need in terms of the energy transformation. And we are not getting this because we are not regulating finance enough. This is not only a matter of governments putting aside money for this. It is also a matter of regulating what private investors do. And that can be done quite easily if governments are so minded to ensure that there is actually a penalty for investing in fossil fuels and there is an incentive for investing in the green sectors. We are also not doing this in a way that will ensure equality. We are allowing private finance and private wealth to continue to make money off itself, essentially, rather than out of benefiting the people. So we are getting obscene levels of inequality, which explode every year when it's measured. This is the time of year when we get new estimates of global inequality. And each year, the increase is startling. Ever since the pandemic started, we have had the top 10% making all of the gains of any income increase. We've had the top 1% gaining hugely, many hundreds of times of increase of their assets, the value of their assets, in a period when most of the world has been suffering. And we're getting dramatic increases in their surpluses, in their profits, in the assets that they're allowed to retain without being adequately taxed, without ensuring the kinds of investment we need to make sure employment grows, to provide adequate public services for the people. Now, all of this impacts on health. In fact, we now know inequality is bad for health. There is some excellent work by many people, some of whom are probably present here, that has shown how inequality is not just bad for economics, it's not just bad for justice, it's not just bad because it creates political instability, it's actually bad for people's health. So we have to address this internationally and nationally. Too much of the international architecture enables greater inequality within countries. I don't know how much longer I can go on for. If I could just get an indication, I can talk, as you can see, about all of these concerns for a very long time. But perhaps I should now move to the regional and national architecture. Because I think many of us recognize these things have to change internationally, but we also are unable to figure out what we can do when the global architecture continues in this way. What can we do within our own countries and within regions? And here, in fact, the Club of Rome's Transformational Economic Commission and the WHO Council's various reports, I think, are extremely useful because we are talking about different levels of engagement of communities, of states at local, regional, national levels, where you can still change things, where you can still reorient the way governments function, where we start thinking of it holistically, where we start thinking of the problem not in terms of a different sector for health, in which we only think of what we need to do within that sector, that department, that ministry, but in terms of the broader one government approach for looking at health in addition to other sectors. But also we need to think of how we can redirect regional economics, because much of what I'm saying is not going to change immediately on the global scene. If we can actually get much greater regional cooperation on many of these issues, whether it is sharing technologies, whether it is controlling finance, whether it is redirecting trade in ways that actually ensure you can generate employment and benefit from better trade access in critical areas for your own, within a certain subset of countries, that too needs to be done, because the turnarounds we need are urgent. We can't keep waiting. We have, Sandrine will tell you about the different turnarounds that we've proposed, but reducing poverty, eliminating poverty actually is essential to this. Reducing inequality is essential to this. Empowering women is necessary for doing all of what I've said, but empowering women is also necessary because it's something that doesn't, again, just happen with economic growth. It doesn't just happen with a bunch of other policies. It is something that we have to consciously strive for and seek. And it has hugely positive implications for all of the positive outcomes that we want. And of course, we have to do something about our global food system. Another critical turnaround, which I think I've just mentioned, but we know that that system is broken. We know that it is unsustainable ecologically, and we know it's deeply unhealthy. It's creating patterns of food consumption that create massive malnutrition. Sometimes in the same household, you will get undernutrition and malnutrition of the overnutrition kind, simply because we have changed food patterns largely driven by major global agribusinesses, their advertising, their marketing patterns, the patterns of trade they have encouraged, the kinds of consumption desire that they have created to have particular types of food all year round, greater reliance on processed foods, and so on. All of that has got to change. We have to get back to much more sustainable, locally reliant systems of food production and consumption. We have to get back to patterns of food production that are in harmony with the climate, of course, but with the local ecologies, without displacing people, without destroying other types of biodiversity, and in ways in which adequate nutrition is actually the standards of adequate nutrition are met. At the moment, in my own country, in India, 72% of the people cannot meet the FAO's requirements for minimum affordable diet, nutritious diet, because it's unaffordable, because their livelihoods and incomes do not allow them to meet that. That's just in India. But of course, across the world, we have this huge problem. It's partly because we are not providing adequate incomes and employment, but it's also because we have a global food system that is fundamentally broken. So we have a lot of things to change. And we can, that's the point. The good news is we can actually change all of them if we sufficiently make a noise about it, all of us together, which is why I'm so delighted that this particular meeting, this conference, has made this an important stream in the discussions. I'm also very eager that participants in this conference join with others, that we form broad coalitions that are arguing for, demanding these major changes at national, regional, and international level. Because without that, we are not going to be able to confront the challenges that we are all so very well aware of. Let me stop here, and thank you very much for having me.
Thank you very much. I mean, that was great because Jayati's gone through the global problems that particularly generally are there, but also have worsened inequality during the pandemic hugely, but also into the regional and national, and very on time. So thank you very much. And we believe that you're going to be staying here through the ongoing conversations. So it'll be great if you bring more points in as the conversation progresses. So we're moving on now to the armchair discussion. We've got on the panel Ritu Sadhana, who has already been referred to by Jayati. She's head of the Secretariat supporting the WHO Council on the Economics of Health for All, based at WHO in Geneva. I'm not going to go into everybody's detailed bios. I'm just going to give summaries of each. Ravi Duggal was supposed to be joining us online. As I apologized, he won't be able to because of ill health. But he's a sociologist, and he used to work for the he's been involved in health services research, advocacy, and training, especially related to health economics, health systems, and health policy, budgets, decentralization, governance, etc. Hani Sirag, who's from Egypt and currently working at the in America. He's assistant professor, Department of Internal Medicine, and director Global Health Partnerships at the University of Texas Medical Branch. He's also part of the People's Health Movement. Ron Labonte, to my right, is a distinguished research chair in globalization and health equity and professor in the School of Public Health and Epidemiology in Ottawa University. He's also, if anyone saw Global Health Watch, he's been very involved in the coordination of the current edition of Global Health Watch. Thomas Palu kindly agreed to join us. He's not in the program, and we spoke to him during the session. Thomas is advisor on global health coordination in the World Bank office in Geneva. So we're going to continue now with a discussion. And as a true conversation goes, it may change from how we had planned it because it will change according to what emerges. So I'm going to ask questions of some of the people who are present, and I'm going to put across some of Ravi's points that he sent through to us. So what are some of the key tenets of economic health for all policies that simultaneously decrease inequalities in income and wealth, and that achieve a safe consumption space, protecting both human and planetary health? And I'm going to start with Ritu, who's already been referred to in the presentation. As head of the Secretariat of the WHO Council on the Economics for Health for all. You've also hosted a side meeting on its work earlier this week. Could you describe the approach this council is taking to the issue of economic reform, this valuing health for all, such that inequalities are reduced and human and planetary health are protected? Why is this important now in the context of PMAC 2023 conference theme? Just remember to try focus on the main issues. Thank you.
Thank you very much, and it's just terrific to be here right at this session and also all week. So as we discussed earlier this week, the Economics Council was convened by Dr. Tedros, WHO's DG, with Mariana Mazzucato, who's at the University College London, as our chair. It started its work about 18 months ago, and we've talked about, with Jayati Ghosh at the side meeting, about its manifesto, that we need a radical change from health for the economy to economies for health and well-being, as she also just mentioned. What we're trying to do is to use this goal at the center of how we think about purpose, value, and growth. And that values need to be the starting point for this change. So, for example, in our brief on valuing for health, and all of these are on our website, we've identified 3 very specific values. One is to value planetary health. So health for all is not health only for all for people, but also for planet. And Kate Raworth, a council member at Oxford University, she proposed this enlargement, which of course was very much appreciated by all council members. And it's outline, it's aligned to her visual framework for sustainable development, the donut economy. A second value is to value the diverse social foundations and activities that promote equity, including social cohesion, supporting people in need, and enabling communities to thrive. And then our policies and metrics to evaluate progress must also value health and human health and well-being, with every person being able to prosper physically, mentally, emotionally, with capabilities. So these are clearly echoed, I think, in the discussions at PMAC. They reflect a social determinants of health and health equity approach, privileging indigenous people's values and intergenerational solidarity. This also draws on Amartya Sen's views that freedom to achieve well-being must be understood in terms of people with capabilities. So just a few more comments on, I know that over the past week, many have recognized that depleting the planet solely for GDP growth is an absurd obsession. I think Richard Horton said that, and also Vandana Shiva, almost the same words. So people from the North and the South. Marilyn Waring, who's a council member and a former parliamentarian from New Zealand, she actually calls GDP and the perverse decisions based on it pathological. So I have to say, though, we are not anti-growth, but growth for well-being and for greater equity. And that's why the council has focused on the governance of innovation. Jayati kind of mentioned that. And what we would like to see is that we condition private investments to ensure a fair distribution of benefits. We also want to value unpaid, volunteer, conservation, and community work that often promotes biodiversity, community well-being, and social cohesion. In terms of why now? Well, if not now, when? It's really comforting that there are many people who are now speaking out who have a lot of followers, but honestly, I think we are a bit path dependent that may lead us away from health for all. So first of all, we know that there is a severe underfinancing of health systems worldwide, and this really must stop. WHO and the World Bank documented just before the pandemic, about 65% of households in low-income countries could not obtain essential health services because they had financial constraints. They couldn't afford it. This is more than triple the amount of households who lacked access because services were unavailable. So, in low income countries, government expenditures on health as a percentage of GDP has declined since 2004. Many countries spend more on servicing debt than their allocation to health, and sometimes even their allocation to other social services like education. So, this is kind of terribly unacceptable after all these years of discussing health for all and UHC and human capital. Second, I think all the climate points, science points, to a tipping point. Now I understand we've passed 6 out of the 9 planetary boundaries. And third, besides the deaths and illnesses, the pandemic's initial impacts on people and their ability to meet basic needs were substantially different. We can't repeat this when we know what can be done. Recall in 2020, the lockdowns and physical distancing. It doubled the headcount poverty index from 5 to 9% in 29 European countries, as the European Economic Review published. But the impact in many middle and low-income countries who were already struggling was much worse. Think of Nigeria. Extreme poverty increased about 7% to 95 million people in 2020. But that's almost half of the population. And in 2022, the government did a multi-dimensional poverty survey. 63%, or 133 million people, are being deprived on a range of health, education, and living standards indicators. I think Jayati also mentioned, this is major suffering.
Okay, thank you. Ron, I'm moving on to you now. Following the last PMAC, you wrote some articles in which you questioned whether our centuries-old capitalist economic system, and certainly its neoliberal excesses of the past 40 years, can make the world fair and ecologically sustainable, very in line with the current conference. Can you say a little bit more about this? Why you think capitalism is no longer fit for purpose? And if not capitalism, then what?
Okay, thank you, Bridget. Yes, so I'm going to name the big C, right? So we talk about capitalism. And the answer about whether or not it's fit for purpose partly depends on what we mean by the term capitalism. If it's a kind of a market system that can create economic practices that promote human health within our planetary sustainable boundaries, fine. The question is whether or not it's actually capable of doing that. And I think the answer there is probably not. Now, when capitalism first arose, it was actually a fairly progressive movement. It displaced the rule of monarchs with the rule of the claimed neutrality of the marketplace. Fair enough. It also elevated the importance of individual human rights. At least for men, because it took a couple of centuries more before it was applied also to women, and even longer to indigenous peoples. But even then, the advocates of this liberal market transformation cautioned on the importance of the state to intervene to correct what they saw as market's inevitable creation of inequalities, and now post-industrialization, as we've seen, certainly our kind of climate chaos and our ecological degradations. So pretty fundamentally, and a point that has been raised already several times during this conference, and that just in a moment or two ago by Ritu, is, and as we'll hear more from Sandrine Dixon-Declève in the final session, who is the co-president of the Club of Rome, is that capitalism is based upon an ever-expanding spiral of growth. And now, at the very least, if not growth per se, if we redefine growth in a more positive way, then it is this ever kind of spiraling up in terms of the consumption of material resources. And that's really what's putting the whole system into crisis. And this was very much worsened with the post-1980s turn to neoliberalism. And that was a response to developing country debt crises, to stagflation, to a slowdown in the rate of growth in profits, and to stimulate economic growth. What a lot of countries did, especially high-income countries, tax rates plummeted, user charges surged, banks were deregulated, trade and investment massively liberalized, and investors began to gamble more on unregulated derivative markets to make money from money, and the cryptocurrency bench is just our latest example of that. We also saw massive increases in consumption globally, mostly by those of us living in high-income countries, but also by elites in almost every country worldwide. And all of this precipitated the present climate chaos that we're experiencing, accompanied by this upwards redistribution of wealth and power to an ever-shrinking portion of humanity. Now, on that basis, I would sort of say that's enough to sort of say that capitalism, at least as it has been practiced, is no longer fit for purpose.
Thank you, Ron. Exactly within the 3 minutes. Thank you very much. Before I go to Hani and Thomas, I'm just going to go through a few points that Ravi Douglas put across. So we asked Ravi about, stating India is a huge country in an area and population with significant inequalities, and asked him to describe tendencies in India. Is the economic model pursuing equitable and ecologically sound? And if not, what are the prospects for economic transformation? So Ravi noted that until the 1980s, the poverty was high inequality in India, as measured by the Gini coefficient. It was reasonably low. In post-90s, it has soared. The recent Oxfam report, Survival of the Richest, and India supplement, Inequality Kills, show wealth inequality in India, with rich becoming richer and more people falling into poverty. The top 1% account for 40.5% of total wealth, which is huge. The bottom 50%, nearly 6% of total wealth. During 2021 and the pandemic years, billionaires in India has increased in number from 102 to 142, and their wealth more than doubled from 313 billion to 719 billion in a single year. So in terms of what to do about it, Ravi says a 1% surcharge on the wealth of 10% of the richest Indians can generate enough resources to decimate inequality and ensure universal access to education, healthcare, and social security. For transformation of the economy, tax GDP ratio needs to be enhanced to at least 25 to 30%, and the direct tax proportion increased to more than 2/3, shifting burden to richer Indians. This can be done by more efficient tax collection, introduction of a wealth tax, removal of subsidies and tax expenditures given to corporates, etc. And privatization trends need to be reversed for the public goods like health, education, and social security. So, Hani, I'm going to move on to you. We hear conflicting reports from the Middle East and North African region. How would you describe these tendencies in this region and the economics and environmental impacts of the policies adopted by the post-Arab Spring regimes? What needs to change and how? Thank you.
Thank you very much, Bridget. Yes, conflicting reports from the region. It's due to the transformation of regimes and political determinants after Arab Spring. Unfortunately, in most of countries, the military dictatorship has been reproduced in countries. And they continue to use same economic policies, even worse. One of the decisive determinants is the debt. And previous speakers talked about debt. Example, Egypt reached $158 billion external debt, which accounts for 90% of GDP. Tunisia reached $39 billion external debt, which is almost 100% of the GDP. Lebanon exceeded $100 billion, which is 150% of the GDP. These are just 3 examples. And the surface of debts in these countries, for example, Egypt accounts for 30% of the national budget. So we are paying more than 1/3 of the budget just for the services of debts, without talking about who is going to pay these debts in the near or far future. Meanwhile, there is a reduction in the allocations, public allocation for health. So the allocation in Egypt, for example, is less than 3%. Actually, this year is less than 2%, the governmental share. The out-of-pocket expenditure is increasing dramatically in most of countries that were part of the Arab Spring to exceed 60% out of pocket of the social expenditures on health. Another determinant in the region is decision-making. You may imagine that the reproduction of the military dictatorships in the region centralized to a great extent the decision-making. There is no public dialogues, and if they are happening, they are very superficial, and the decision is completely centralized in these countries. Poverty. The poverty is increasing in Egypt, according to the official records, which to a great extent very conservative. It reaches 30% of Egyptians under poverty line, and no mention of Lebanon, Palestine, Yemen, and so on. We cannot talk about the region without talking about the wars, conflict, political instabilities. And in this region, we have Palestine, Syria, Yemen, Libya, Morocco. You can enumerate as much as you want. And one of the examples that directly affect people's health, that the US government stopped funding UNRWA during Trump administration, made it zero. And UNRWA is not a typical UN organization, it's a service provider. So cutting of budget of such an organization directly impact people's health because it interrupts the service provision. Yemen. We have the worst endemic of cholera in the whole history happening in Yemen, with a complete silence of international community. Actually, it's not just a silence. The international community are blessing these practices. The next COP, climate change, is going to be in Emirates. And Emirates is playing a massive role in the war in Yemen. So the international community is actually legitimizing this role of Emirates in Yemen. The previous COP 2027 was in Egypt. And this is a huge recognition and legitimization of the military regime in Egypt, with lots of political prisoners. And when people tried to protest during the COP, they were preventing from accessing it. So the international community is not even intervening, it's supporting these practices, the military dictatorships, and the wars and the conflicts. Thank you.
Thank you, Hani. Thomas, so I've got a question for you about health financing. Can you elaborate the World Bank perspective of health financing, particularly thoughts on financing towards health for all?
Well, thank you. I work for a Bretton Woods institution that is very much part of this current or the world financial architecture that Professor Koch mentioned. We have many economists working. We work in the context of market economy, but with a twist, because our development objective is to eliminate poverty and boost the shared prosperity, which means in reality bottom 40% of income distribution. So equality and of outcomes, equality of opportunity, these are very much part of our mission. So we agree with Professor Koch, and we agree also with many of the problems highlighted. And as Ron said, perhaps we work in the current context and making capitalism work for public policy objectives. That is the space. And in this context, we do address the health and the environmental challenges. And we are pragmatic also, I have to say. We speak to ministers of finance, and we need to speak in the language they understand. That's why we call health as an investment and part of human capital, because these are the concepts ministers of finance understand. And we do fully agree that health is not only a matter of health sector, but also a matter of what other sectors can do on multi-sectoral determinants on health. Yes, we do work in health finance a lot, and we have been monitoring what is happening with countries' ability to finance health after pandemic. We are putting out this report. We call it double shock, double recovery. Double shock means health shock and economic shock coming from pandemic. And we also say that cannot be recovery without of economic recovery without health recovery. So, and I have to say, situation is bleak. We use IMF estimates on economic projections, and we have repeated analysis already 3 times. But according to the most recent analysis, we will have 41 countries in the world that will not recover economically to pre-pandemic levels before 2027. And there are about 4 low-income countries and 14 lower middle-income countries in that group. And then we have further 69 countries that would be much worse off economically than they would have been without pandemic. They are not contracting, but they're not growing either. They are stagnant. That's why you call stagnant. And in this context, asking countries to regain lost progress in terms of SDGs, invest into preparedness, and become more resilient. This is a hard ask to do. But we have conceptualized for ourselves, how can we mobilize money? There are 5 ways to do it. One is grow economy. I know and we see there is a problem with that. So this is pretty much of increased tax overall revenues. This is challenging, but I think we have IMF on board. IMF, in fact, says that in order to meet social SDGs, countries need to increase their uptake of the revenues by 5% of GDP. Third one, prioritize health. And that's why I mentioned, yes, we use economic concepts but that we need to talk to ministers of finance so that they do it. The fourth is efficiency gains. We do know that even in health sector, about 20% may be wasteful spending, so we need to cut that. And finally, external financing. This we also have a little bit of the challenge because pandemic has also hit the rich countries hard, and there are so many crises that really put demands on the external funding. And perhaps in this context, we need to think about external funding in the near future in support of health in countries, be targeted to the most vulnerable countries that I mentioned, what we call the contracting countries, who are not recovering even pre-pandemic levels. And in that context, there is this debt issue that has already come up. Actually, debt is constraining even already constrained space even further. So working with a debt, it is important for both IMF and the World Bank, but the problem is that this is not anymore the simple international financial architecture that we have a Paris Club or IFIs that hold the most debt. Debt is now held by a very diverse set of actors, including countries that are not part of Paris Club, big countries, powerful countries, but also private debt. So I think this is a challenging context, but ultimately we'd like to say we share the problems, understanding of the problems, perhaps the ways how to address it, we try to address them in the current context. Fit for purpose was mentioned. Indeed, I think there's a lot being discussed, and this is the topic also for our international finance institution. We call it Evolution Roadmap. And this in particular in the context of ability to finance or support global public goods, climate change and preparedness. Because our business model, frankly, has been countries, but these problems way transcend country borders. Thank you.
Thanks, Thomas. Jayoti, would you like to add, question, pull out any particular points? You're very welcome to at this point.
Thank you so much. Yes, I would very much like to. I think, many of the panel have developed and added a lot of important aspects to my very broad discussion before that. And I would like to pick up on a couple of points that were just raised by the last speaker, by Mr. Palu, I think. Essentially, I think he mentioned the need to raise taxable revenue. That's absolutely essential. And it's critical because it's one of the ignored aspects of recovery and revival. We have mentioned that I personally do think that the international financial institutions today are not fit for purpose. Yes, everyone agrees on the problems and the challenges and the concerns, but they do have the power to do more than they're doing, even under the current articles of agreement. So it's not just the bureaucracies. It is, in fact, shall I say, the voting blocks in the IFIs that are impacting that. But with regard to international taxation, again, this is another global system that's broken. This was developed in the late 19th century, actually, well before multinational corporations existed. And so multinational corporations are treated as if they are different companies in each country, arm's length, as you were. And this is what enables them to shift all their profits out of high tax jurisdictions to low tax jurisdictions. And which is why most of them get away with paying effective tax rates of 4 to 6% instead of the normal tax rate, corporate tax rate in whichever country they operate in. There is a simple solution. It involves basically shifting the onus of tax paying to the global company, saying when you are one company, every country will actually tax their share of your global profits according to their national rate. And that share can be determined by, I'm a member of a commission, the Independent Commission for the Reform of International Corporate Taxation. Professor Joseph Stiglitz and I co-chair that commission. We have been saying that, in fact, we should use a formula that is, let's say, 60% sales, 20% employment, 20% assets in that country. And every country taxes their share of the global profits. With that, we have also been arguing that you need a minimum tax globally to, again, prevent that incentive to keep moving the profits around. Now, the OECD initiative actually did recognize both principles. They have watered it down to such an extent that it's actually meaningless because they're not taxing all the profits. They're not saying all of it can be pooled and taxed, only that amount above 10% and only a quarter of that. So it's ridiculous. And they proposed a minimum tax rate, which is so small that it's close to the tax rates of tax havens like Ireland. That's only 15%. Whereas the average tax rate globally, the median, is 25%. So there is things that can be done with international agreement. If there is no international agreement, which is happening at the moment, once again, rich countries driven by their corporate lobbies, not because people in those countries would benefit, but the corporate lobbies in those governments has prevented it. This is being blocked. So what can countries do? They can combine, they can do regional such agreements. Latin America, Jose Antonio Ocampo, who was the chair of our commission earlier, has proposed such a regional agreement. They can do other measures. Countries can operate even unilaterally to generate more tax revenue. I do believe if the IFIs are serious about raising tax revenues, they should be supporting such a demand. They should be encouraging more taxation of the rich, for example, instead of preventing it, as the IMF agreement did in Pakistan and in Sri Lanka. Instead of preventing further taxation of the rich, they should be supporting taxation of the extremely wealthy and pushing for national asset registers that force everyone to reveal the beneficial owners of all wealth. These are things the IFIs can do. These are not, instead of pushing for only regressive taxation measures, like value-added tax and so on, it's time to tax those who can afford to pay. And ideally, this can be done in a global agreement. If it's not done, that countries can do it regionally, countries can do it within their own governments. And if the international financial institutions don't support them in this, then what does it tell you about, if you like, where the relative power that informs these organizations is actually based? So I just want to highlight that tax. There are a number of other issues I would love to respond on. One is but maybe I shouldn't take up too much time. I can come back if there's more time later.
Thanks so much. That's very useful. And we just we're going to throw the questions around a bit now and continue on the taxation questions. And Thomas, we don't have any particular question for you here, but when we get to you, if you want to respond to any of the challenges that Jayati has put across, or if you want to respond to what anyone else says, you're welcome. So, one of the long-standing arguments is that we have seen the levels of redistributive taxation vital to provision of public health and environmental protection services erode substantially since the dawn of the post-1980s neoliberal era. Isn't economics of a health for all as simple as ensuring tax justice for all? Ritu, we're going to start with you on this one. Is this an issue that the Council has tackled?
Thank you very much. I think from the discussion, Jayati and I have conveyed that the Council is promoting multiple economic and financial actions addressing the root or structural causes that affect the way societies are organized, including what stratifies societies and the importance of infrastructure and systems that determines people's access to resources and opportunities. So we need to build up a more equitable society. We also have to mitigate negative impacts on households. So we need to ensure that people have financial literacy, financial inclusion, and policies that reduce financial burden. So even though tax justice for all is not sufficient to provide health for all, fair taxation is very important. And as Jayati mentioned, there's many different levers, global carbon tax, wealth and progressive income taxes, among others. But, I think it's also considering what governments must do. Not doing so after the enormous scale of tax avoidance documented by the Pandora, Paradise, Panama, and Bahamas papers and other leaks also would uncover or illustrate the weaknesses in governance, and not just governance by countries, but by global institutions. So we need to build up governance capacity to reduce fossil fuel subsidies. And I think we've had a lot of discussion, almost 6 trillion globally annually. We need to facilitate wealth taxation, building on the EU's decision. I think Jayati just noted that the Council probably will propose something much higher than the 15% the EU has already taken. The Council has also released statements on what is at stake during the COP27 after 2 consultations with civil society networks, including the Global Health Council that facilitated that. 10% of the world's wealthiest are responsible for around half of global carbon emissions, so a global carbon tax will probably be proposed as well. And to build capacity, countries can create or strengthen national asset recovery offices. that also share information across countries to reduce illicit financial flows and facilitate wealth taxation. I think Jayati just mentioned that the Council also agrees with the Independent Corporation for the reform of international corporate taxation, and it calls to implement the same tax rate for multinational corporations as the tax rate for domestic companies. Finally, windfall taxes on excess profits is an additional example of a policy tool that can achieve a higher tax revenue with the aim that these revenues are used towards supporting determinants of health and well-being. I think, Ravi, you mentioned, Bridget, some of the data from what Ravi cited from the recent Oxfam report, Survival of the Richest, which does document this obscene imbalance. So I think those are some of the things, but we do have a framework that looks at different areas and entry points for action, not only in tax.
Thanks, Ritu. I'm moving straight on to the questions. I'm very conscious of time and that we want to leave an adequate time for discussion. So, Ron, you've frequently quoted an early 20th century US Supreme Court judge who notes that taxes are the price we pay for a civilized world. And we might add to that an equitably healthy and environmentally protected world. How well have we succeeded or failed in this respect? And what are the global barriers or enablers to making progress in this direction?
Okay, thank you. The Supreme Court Justice in question is someone named Oliver Wendell Holmes, and one of the Supreme Court justices that the former President Trump did not appoint. So, and had that saying about taxes are the price we pay for a civilized world is engraved in granite in the portico of the U.S. International Revenue Services, which, given the enormous tax cuts that the Trump administration put in place, I could only conclude that the members of the Trump administration could not read. Now, in high-income countries in the immediate post-World War II era, tax rates were much fairer and they were much higher on the high-income earners, on corporations, and on a variety of different kind of formats that really were important in redistributing wealth from the top down to the bottom. Now, excuse me, when neoliberalism came to a kind of global economic dominance as an orthodoxy in the 1980s and onwards, since that time, as we've heard already, tax rates shifted about, became much more unequal, dropped in terms of high-income earners, really declined around the corporate sector. This also occurred in conjunction with the growth in offshore tax havens, offshore financial centers, as they're kind of rather described in a very polite way. Now, using the World Bank data sets, I've been monitoring and monetizing the value of global tax revenues, so across the entire planet, relative to the global economic product in any given year. Now, I could only do that since about 2002 when these data sets first became available. And when you look at 2002, the total value of untaxed global income was around $45 trillion. Now, in 2019, less than 20 years later, in the most recent data that I could find, it now totals $75 trillion. And so the rhetorical question is, do we really need to have $45 trillion floating around in untaxed income, especially when that money could be used for essential global public good purposes at a time when we're facing massive inequalities, climate chaos, ecological degradation, etc., etc. Now, if we think about the enablers for tax reform, there's the work and the voices of scores of activist civil society organizations. So Oxfam this year in its Davos report didn't report so much about the maldistribution of wealth and income, but it really drilled down on the issue of taxation. We have the creation of Global Tax Convention that's now underway at the United Nations that was sparked initially by the African group of countries. The international agreement to a minimum of at least 15% on corporate taxation. Although I know that Jayati has mentioned in the past, and I agree that it should really be about 25% or 30%. And the trying to close all of these offshore financial systems, these offshore financial centers or tax havens, most of which exist under the aegis of the high income countries, which are, of course, where the corporations are housed and the wealthy individuals are housed. The number one tax haven place in the world, it's not one of the Caribbean islands, it's not the private banks in Switzerland, it's the US state of Delaware. And there are more corporations registered in the US state of Delaware than there are people who live in the state of Delaware. Now, the barriers for tax reform is the usual crowd of some governments, transnational corporations, wealthy individuals whose wealth and power would decline under such reforms as it should, and who are actually, though, rather attached to their privileges. But the global poly crises that we are facing now will soon give them no choice in the matter, because either they rapidly initiate radical reforms or we begin to see national and global social systems in the world order begin to fall apart.
Thanks, Ron. I'm just going to bring in a few points from Ravi at this point and then turn to Hani, Thomas, and Jayati. So Ravi was asked about taxation as an issue in any decision making about public budgeting and what his experiences have been. So he notes that advocating for progressive tax reform is not easy given low tax GDP ratios under present capitalist regimes. Civil society organizations have been engaging with this globally, but governments rarely listen to them. So much more stronger global networking and collaboration is needed to strengthen progressive tax regimes. An alternative would be to advocate for participatory bottom-up budgeting, where communities take active parts in formulating budgets, monitoring implementation, and conducting social audits. I'm summarizing, I've got the liberty of summarizing what comes across from Ravi. And our time is moving on, so just a reminder to try and stick to the time. So, Hani, Oxfam last week at the World Economic Forum released its annual report on economic inequalities, emphasizing the need for taxation reform. It is far from alone in arguing for this. We're hearing it a lot here in the session. Will taxation justice serve health development and environmental protection regardless of the economic order? And are any governments listening?
Yeah, thank you very much, Bridget. Yeah, of course, the progressive taxation is quite important to make revenues for healthcare and other social services. This is quite important, but alone, it doesn't work. And if the economic policies continue as they are, actually increasing the revenue would increase the centralization of wealth. Health systems in many places, they act to re-centralize the wealth, collect the money from broader number of pockets and put it in fewer number of pockets. And just few examples for that, the notion of health insurance and purchasing the services based on competitive basis from private and public sector. Unless we invest public money in the public sector and make it more competitive, it's going to end up that we purchase services from private sector, and this might lead to monopoly in the future in health services. And instead of we just pay money for health, we pay money for the profits of private providers, and this will re-centralize the wealth. The medicine prices, if we continue unable to regulate medicine prices, we will end up paying most of the taxation money we are collecting for health in the profit of pharmaceutical companies and health insurance companies as well. And one of the good examples for the unregulated medicine prices, you may remember the medicine for Hep C, which coming from Egypt, it was 15% of people in Egypt with Hep C, and the first price for the new medicine Sovaldi by Gilead was $100,000 for 12-week regimen of treatment. This is, if we continue accept something like that, I don't think any taxation reform is going to be beneficiary. And here it was not a problem in Egypt, it was a huge problem in the US itself when the insurance companies could not cover this new treatment for quite a long time in the beginning, and people were not able to access it. And if you look at the profits of Gilead, they made 11 billion dollars net profit in the first year. This is not needed. This is not acceptable. So, just to summarize, if we continue not to regulate the cost of healthcare and make investment in public sector to make it competitive in healthcare provision, in medicine production and medicine distribution, and if we do not have pricing policy for health technologies and medicines, any progressive taxation, it might end up subsidizing the private sector and subsidizing more profits. Thank you.
Thomas, I said I'd give you a chance. I'm actually going to open it up for questions. I'm very conscious that during this conference, there have been some very interesting inputs from the floor and questions from the floor, and everyone will have an opportunity to respond to those afterwards. Is there anyone wants to ask a question, come up to the microphone? Please do introduce yourself and try to keep to the point. If you're making a point, put it across quite firmly. If you're asking a question, say who you're redirecting the question to. Go to the mic if you want to speak, and I'll call on people in the order they go there. First one, thank you.
Yes, thank you very much. I'm Dr. Inoka Suravira from the Ministry of Health in Sri Lanka. What I want to ask is, now when it comes to health financing, especially when you take the health budgets, it is discussed that it's not enough. But within the health, how they finance the different sectors. Now, for example, the curative sector and the preventive sector, I suppose there are a lot of differences, especially the preventive sector being underfinanced. So we are making more people sick and then we are treating, and whatever the little money that we get for the health sector is mostly spent on the curative sector. So do you think that we will be able to save the planet as well as do justice to the future generations if we sort of, finance the health sector this way? Thank you.
Thank you very much. I'm going to take another question. Erica, introduce yourself.
My name is Erika Arteaga and I am from Ecuador. Just a quick thing. Ecuador has been doing a sue against Chevron Texaco for 30 years, and we have not been able to win this sue against this company. The World Bank has an intermediation agency, the ICSDB, and now oil companies are suing my country because we don't let them have enough revenue. So this issue that you presented, that countries are sovereign and countries should work on tax reformation and tax reform, this does not work for countries as small as ours. So what is the role of ICSDB promoted by the World Bank in ecological justice?
Okay, so the first question I don't think was directed to anyone in particular. Do any of the panelists want to pick up on that? Ron.
Well, I think that the question in terms of if we get funding for health, we take it from social protection. or we take it from environmental protection, or we take it from other kind of important sectors of the kind of programs or services that governments are supposed to provide. I think one of the things that we need to do is we need to challenge the whole idea of scarcity, that we need to trade off one sector against the other. I thought that the point that we've been making about the extent to which massive upwards redistribution of wealth and a decline in any kind of progressive taxation or capture of that wealth to be used for public good purposes. If we began to work at that level, the question about, oh, do we trade off this versus that? It begins to disappear. Because right now, with the poly crisis that we are facing, we need to have access to a lot of funding, a lot of capital. And progressive taxation will take us part of the way, but we really need to look at a global scale, how do we begin to look at redistributions of the resources that people need to live decent lives? Because in the high-income countries, we don't need to grow anymore. And heaven forbid, we need to consume a hell of a lot less to make space in terms of the material resources that the planet can regenerate for those people in poorer countries that actually need to grow a little bit more. So I see this as a challenge of massive interventions for massive forms of redistribution and equity within the planetary boundaries.
Thanks, Ron. Thomas going to respond, and if just before Thomas starts, if there are any other questions, please go up to the mic, because we will move straight on to that after Thomas has spoken.
I think thank you for the question from Sri Lanka, and I think Sri Lanka is currently in a difficult economic position. But in this context, just what has changed compared to 90s, right? It's the IMF will come out soon with a guidance note on health spending, and we expect the key message to be countries are spending too little on health. IMF still writes the Article 4 memorandums, and often in this current economic context, I guess also in Sri Lanka, they talk about fiscal consolidation. But now they say, but in this context, protect the social sectors. I now come to turn the tax discussion a little bit around. I think, Ani, you mentioned that. It's one way, one issue is how we raise tax revenues. The other way is how to use them. And then get into this question also, because the having the redistributive impact to the use of tax revenue would be very important. And in health, the most kind of equitable and redistributive impact it is, you protect on the universal health coverage the poor, you invest more into primary healthcare and preventive services because they benefit is more the poorer segments of population. So, but in reality, how to do it? It would be very difficult to take it away from elites, from hospitals. But any increase that comes, I think we would strongly argue that this should be disproportionately allocated for the preventive and primary healthcare services.
Do you want to respond to the second question, Thomas, from Erica?
Yes, well, unfortunately, I don't know the intricate details how the arbitration process work. I think we are involved. Yes, the World Bank as an institution, it's one of the small part of our World Bank group, but I don't know the details to comment on this.
Ron?
Yeah, I know some of the details around these arbitration cases. I think that it's probably, in fairness, important to point out that the World Bank administers the ICSID, which is the acronym of the organization that sort of holds these kind of relatively corporate lawyer legal kind of tribunals to evaluate these decisions or these ideas of that somehow a government policy is reducing the profit, taking or destroying the profitability of an investment from a foreign investor. Now, the whole international investment treaty system is under a lot of criticism. You have countries worldwide trying to withdraw, get out of these investment treaties. You have some who are still trying to promote it. But what these essentially do is they allow private investors in corporations to sue governments around policies that they think, under very vague language in many of these investment treaties, as somehow expropriating some of their potential profit, their actual value of their investment or their potential profit. And in some cases, they get awarded billions of dollars on the basis of complaining that their $30 million or $40 million of their initial investment has been destroyed. So it's not the initial investment. It's the fact that they were and they're getting arbitration awards that sort of say, we will project 20 or 25 years into the future what you could have made on the basis of this kind of environmentally destroying extractive industry. We're going to then award you all that future profit that you forewent because the government went in to do what was in fact was the correct environmental decision. The United Nations Conference on Trade and Development, even to some extent the OECD, certainly at the UN level, there's a real push to try to alter those investment treaties. And many governments now are trying to basically just cross them off because they work for private finance and for transnational capital. They don't work to protect people. They don't. So anyway, that's enough said about that. But it's not the World Bank's fault. Okay, the World Bank administers the system by which these arbitration panels meet and make a decision. The fault of that is in governments that actually sign these investment treaties or promote these investment treaties in the first place.
That was clearly put. We've got a 20-minute video. There's 10 minutes. So what I'm going to actually ask is very, very strict 2-minute summary by each of the panelists, as well as Jayati.
Could I also speak? Yeah.
Yes. So I'm going to give you that. Do you want to speak to this now, or do you want to add it into the summary?
I would like to respond to just the points that I made, but I can also summarize as well, and then so you can move on to the other speakers.
So I'm going to the beep that you sometimes hear is because I'm setting a timer, and I'm not going to be so quick to turn it off if people talk too long. So Ron, I'm going to start with you.
Well, I would make probably two major points. The first is an issue that we really didn't get to discuss too much on, but I know that Jayati has done a lot of work around that, and that's the looming global debt crisis and the sources behind that, and how that has led to a response on the part of the IMF and other kind of creditors for new rounds of austerity. And the austerity that was imposed earlier on after 2008 financial crisis was really quite destructive, and under some of the early structural adjustment programs was really quite destructive. We don't need that austerity. There are other options, and perhaps Jayati, you could talk about the special drawing rights issue with the IMF. The other that I would point out is that if we consider, we have to reconfigure how we think about growth. If we put growth only on the economic GDP kind of measures that all governments use, and right now they're claiming we got to grow, that's based on material consumption. And if it's based on material consumption rather than alternatives in terms of well-being, health, equity, planetary kind of replenishment, we're just going to wind up eating the planet to death. We already consume 1.7 times each year what the planet can regenerate in terms of its resources. And if everybody in the world consumed at the level that the 1% are consuming at, we would need almost 5 new planets. And maybe that's why the billionaires are busy flying off to space to sort of exploit new mineral resources out there, or to build some offshore mansion someplace else, some off-planetary mansion, because of to avoid the crises that are coming. So we really need to eliminate that consumption.
Thanks, Ron. Inside the 2 minutes. Ritu.
One of the things we've been looking at in the council is better governance. So the issue of the big change in terms of not having vaccine equity during the pandemic exposed this problem. So WHO and the Medicines Patents Pool partnered to create the mRNA Global Vaccine Hub with 2 objectives: install a capacity to manufacture vaccines where there's already some degree of capacity, but extend it, and have the foundation for creating capacity in countries that actually lack the capacity right now. So the hub is Afrigen in South Africa, And there's so far 15 institutions that are a part of the network. 5 are in Asia, Bangladesh, India, Indonesia, Pakistan, and Vietnam. So what the council is trying to do is to put together an alternative business model based on the goal of the lowest cost per putting a dose into the arms of each person within a timely or strict time period, rather than the lowest cost per dose. And this really puts in practice our approach to health for all. We need a new production system and a new production function that moves away from solely proprietary competition framework that privileges very few suppliers to a health for all system. This should not be viewed as a utopia, nor just limited to pandemics, but I think it can be part of a solution towards the right to health that's developed with stakeholders. Just one example of increasing the pie. Vanessa Wang, she's a council member and an investment banker from Hong Kong. And she predicts that if there is a unified taxonomy for financial market investments in health that are directed to health for all, this could really support the ESG investment decisions. And what's important is that under ESG, we have tripled between 2016 and 2021 to almost $3 trillion the amount of investments that are under management. So this is an important avenue for us to pursue and see more from what the council proposes. Thank you.
Thank you. Thomas, I'm moving to you next.
Yeah, the growth has been mentioned, and of course, your organization that is very much growth-based. But I just want to say that the GDP growth needs to be accompanied other indexes as well. We have Human Development Index, we have Human Capital Index, we have Gini coefficient, and other distributional impact measures. These are very important. And GDP is not the full story, that to very much agree. I'm heading tomorrow to Laos, who is a lower middle income country based on GDP because it comes from natural resource extraction. But for most other development outcomes, it's a poor country. So I think we see shortcomings of GDP and need to manage this around that. As Andres said, it's kind of in the core of the black hole, but we need to look at what is around and how can we address this problem. Very much, we need to increase resources for health, both for the health sector, but also health in other sectors. We very much agree, and including the use of health taxes. I think we didn't discuss that as a potential revenue source, but that would deliver both health and revenue, and then use them well. Because from ministries of finance, we hear, yes, we hear you, we make a case for health. The next question they have, how can we use them? I think this is ministries of health need to be a little bit learn how to speak to the ministers of finance about the use of resources and delivering the outcomes that improve health and equity. Over.
Thank you. Hani.
Two quick points. The one of them is who's paying the bill, and COVID-19 was a very good example to teach us who really paying the bill. And if you look at the vaccine development and vaccine distribution, who pays for the development of vaccines? And US is a very good example for that, both Moderna and Pfizer and Johnson and others. Moderna, one of the examples that the public revenues paid more than $2 billion in the investment for the development of the vaccine. I mean, more than 1 billion was from NIH by itself. And then we are purchasing the vaccine again. So people paid for the vaccine twice. Once, support the development from public revenues, and once, when they purchase it with the price that was decided by the company. So this is kind of insane. So this is important. And in addition to that, those who were most devastated by COVID-19 were people in color who did not have the privilege to stay home and work from home, those who were in the front line of healthcare providers, which also 70% of them in the US, for example, are people in color, and so on. So who paid the bill? This is very important. The second point is the governance. If we continue to talk about multi-stakeholders, like everybody should be on the table without very clear system to manage the differential interests, this is not gonna produce any kind of equity. Private sector cannot be a part of the decision making simply because they just represent the shareholders, and this does not legitimize them to be a decision maker. Private sector can work within provided boundaries that publicly agreed, publicly developed. So this is very important to look at the governance at both national and international level. Thank you very much.
Jayati, over to you.
Thank you very much. And I want to very strongly agree with the points that were just made. I think there are two themes that have been recurring throughout this discussion: inequality and state capacity. State capacity is reflected in different ways, in taxation, in the state's internal capacity to make particular changes, and in the extent to which it outsources activities and effectively privatizes activities. But also inequality is a direct result of a lot of that. And we've heard it expressed in many different ways. It's not just in redistributive terms, in terms of the taxation policies and expenditure policies, but it's also in the pre-distribution, in the regulatory processes, in the ways in which you allow some to make inordinate gains at the expense of others. And we just had an example of that with the mRNA vaccines. So I think what I would like to say, if you like, overall, is that what we need to do, and this our council briefs in the WHO Council have also talked about this, we need to develop state capacity because we know that the countries that have developed state capacity adequately are also those that have more progressive taxation systems, are also those that have more progressive expenditure patterns, are also those that have less inequality, are also those that have much greater equity and enabling of social and economic rights for all. I also want to emphasize that targeting is a way of killing programs. It's only when a program is universal that you actually ensure that the interests of all of those, including the powerful, are not misaligned. Because when you target to the poor, you actually make it a second-class activity in which the rich and the middle classes are not interested, and they don't bother about the quality, they don't bother about the resources going into it. And this we have seen over and over and over again. So I want to make a very strong case for universal provision of the basic social and economic rights. That is in health, in education, in nutrition, in sanitation, in housing. We have to ensure that these are actually available to all. And I would argue social protection. And it's not targeted to the very poor, because that is really a way of not just diminishing the quality, but ensuring that even the poor do not get access through various problems of type 1 and type 2 errors, unfair inclusion and unjust exclusion. So essentially, we have to develop state capacities, which also means that states themselves must have a greater responsiveness and flexibility in listening to democratic demands, in ensuring that they build their own capacities rather than outsource, let's say, to consultancies, which has become another fad of the times, external private consultancies. And that, yes, that they design economic systems led by people's participation, of course, as Ravi mentioned, but that they design economic systems in which private investors play a role, but that role is guided by the broader social goals and planetary goals. In other words, it can't be the private investors deciding on behalf of the rest of society simply because they hold economic power and therefore political power. It must be that they have to conform to broader social and planetary goals. And that's absolutely critical if we're going to do anything about health. Final point, I'm sorry to say, but that despite everything we say about it being a one government approach, we still end up with the IMF and the World Bank going and saying, we will protect health spending, as if that is really going to necessarily help the health sector. No, we've seen that over and over again. You have to think of an all-of-government approach in which you do not make or insist on measures that destroy the capacity of others to live a healthy life. In Pakistan today, the IMF is demanding a cut in electricity subsidies, which is going to dramatically impact the poor of the country and farmers in the country. Now, you will say, oh, that's nothing to do with health. It is everything to do with health. So you cannot demand that the poor of the country pay 50% of their income in meeting electricity charges, and then say, we're keeping our health budget exactly as it was, so we haven't affected it. So please, let's actually think about what we say and put not just our money where our mouth is, but put the whole of our mind into understanding what it means to have a whole of government approach to health for all. Thank you.
Thank you. Thank you so much for that. That's a fantastic summary and ending and a way forward to move now. Before we move to the video, I just want to remind everybody, because I think some people, just in case anyone wants to leave, to please fill out the evaluation form. I want to really thank all of the panelists and especially Jayati for coming online and putting across some really pertinent points. But sorry, Ravi couldn't join us. It gave us a little bit more time. But Ron, Ritu, Hani, and Thomas, thank you very much. And now please wait, because there is a video presentation being done. I think Ron has already introduced. Do you want to say anything more?
Just to sort of say that we're going to overspill into the coffee break by about 5 minutes with this video. So I really ask you to sort of be patient and listen a little bit. It's with Sandrine Dixon de Clèves. She's the co-president of the Club of Rome. And she and I had a kind of a taped conversation where I posed interesting questions and she gave interesting answers. And a lot of it is about the very inspirational final report that was recently released that Jayati Ghosh was involved in producing, called Earth for All. So now let's start rolling the video.
Hello, my name is Ron Labonte. I'm a professor in the Faculty of Medicine at the University of Ottawa and very active with People's Health Movement. And I'm pleased today to have a conversation with the current co-president of the Club of Rome, Sandrine Dixon de Clèves, about their most recent report called Earth for All. In your most recent report, you emphasize the need to upgrade our economic system to create well-being for all within planetary boundaries. And I wonder if you could elaborate a little bit about this and what you see as the 5 great turnarounds that we have to make.
Absolutely. And I think that what we need to do is say a little bit about the fact that we are in the midst of the 50th anniversary of the Limits to Growth. And therefore, the Club of Rome has been doing quite a bit of introspection. The clear messages from the Limits to Growth were that we needed to live within the planetary boundaries, and that if we continued to enable population growth and the stress points on our natural resources to continue due to overconsumption and the focus on an extractive economy, that we would truly see some key tipping points in the scenarios that we have in the Limits to Growth. And those tipping points are where we are today, actually. And I think it's important to remember that through the last 50 years, there have been a series of different warnings that we would reach those tipping points. And now we see the compound effects of COVID, climate, and conflict, in particular in Europe, which are really aggravating the way in which we engage with our economy and fueling poverty, inflation. We decided that for this 50th year, we would come out with some new analysis which would take the system dynamic modeling slightly different, because this is what we wanted to do, was go through that process of understanding where is the world and where can we shift and start to really move from the extractive economy into a well-being economy. And that is what became the Earth for All project. And now the book, which has come out as of this past September, which is called Earth for All, A Survival Guide for Humanity. And the main results from that work, which, by the way, were stress tested by 30 esteemed thought leaders, economists, scientists from across the globe is that we need 5 key turnarounds in order to enable us to get to this well-being economy. And those 5 key turnarounds also show us that the key of those 5 is the first 3, and that is poverty, inequality, and empowerment. Empowerment of women and girls is fundamental to enable us to really reduce our population growth. But most symbolic and important coming out of this research and this analysis is that we all realized that we had to focus on poverty. Poverty is key if we want to deal with our conflict issues, if we want to deal with our pandemics, and if we want to deal also, obviously, with climate change. The other 2 key turnarounds are food and energy, and the interrelationship between poverty, inequality, and empowerment with food and energy. If we're able to shift those systems, then we can actually get to a well-being economy.
In Earth for All, you actually identify a number of new transformative economics. And one of them is green growth. And so a lot of discussion of green growth as our possible pathway forward. How feasible is that kind of green growth momentum in terms of actually being able to accomplish that?
Well, I think the key answer to your question is, what are we defining as growth? And coming back to the original limits to growth scenarios, and also the work of the Club of Rome for the last 50 years, we've tried to unpack that notion of growth. If we still focus on growing, even if it is green, and we do not think about poverty, inequality, and empowerment, we will not actually be able to continue to survive within the finite boundaries of the planet. And so what we're saying is, no matter what we do, we have to think of economic development differently. We have to stop being obsessed with this idea of growth. Why can we not actually stop thinking about growth at all costs and instead thinking about the type of economic development that we need to enhance people's lives and livelihoods? And I am not convinced that the green growth approach is going into the depth of understanding the needs of people and the very absolute need to address poverty as the core issue that is going to actually be the greatest existential risk for all of us.
There is another kind of movement parallel with the green growth, and it's another one of the economic transformative models that Earth for All talks about, the degrowth model. It really advocates the question of reliance on green growth and emphasizes the need to dramatically decrease energy, whatever is fuel source. So it's not just about electrifying everything. We also have to decrease overall kind of consumption of energy, but also material throughput. And the point that you've also made, an end to an economy built upon continually rising consumption levels. Is this model, this idea, compatible at all with the basic tenets of capitalism as we've come to know it, and economic growth, and especially with the rentier capitalism of the post-1980 neoliberal era?
Very good question. And I think, again, what we really need to do is unpack what we mean by degrowth. And we need to get very careful about language, because if we speak to those countries, low economy, low income countries, and talk to them about degrowth, immediately their feeling is, well, hold on, the rest of the world was able to grow at their pace, deplete our resources, and now you're telling us that we can no longer grow. However, the material throughput and the optimization of our efficiencies within the degrowth model is fundamental. And so how do we instead use the language that's necessary and put in place the models, once again, that focus on well-being, whatever that may mean? Now, if we are going to focus on well-being, if we look at the donut economic model, for example, then we have a clear construct of addressing our social needs within the inner donut and our planetary needs and responsibilities on the outer ring of the donut. And I prefer focusing on both the donut, but on the well-being economy indicators, which are being promoted by the well-being governments of New Zealand, Finland, Iceland, Scotland, and Wales. This comes back to your absolute question around, are we going against capitalism and the neoliberal model? Yes, because the capitalistic and neoliberal models are indicating that we need to grow at all costs, that it is only by measuring GDP that we will see that our economy is flourishing. And we would counter that and say a flourishing economy is one that needs to address a very vast variety of indicators, that needs to take into consideration social indicators, environmental and economic indicators at the same time, place of value on education, place of value on social services. It is time now in the 21st century, and now as we are facing these compound effects, to go beyond whether it's a green growth model or a degrowth model, and to become agnostic about which is the best model, and instead think through what are we trying to do in order to enable people to thrive and not survive. Again, as I indicated in the beginning, the notions of continued poverty, of a social index which is going up in terms of potential social tipping points, because well-being is going down, even though wealth is going up.
We've decoupled health and well-being from economic growth, at least in high-income countries. And the point you make about how we have to be extremely careful when we talk about this in low and lower middle income countries, because yes, apart from the elites in those countries that are over-consuming and need to underconsume, just as we need to do in the high-income countries to create more kind of growth space, we need to, I guess, be aware of the fact that most of those ideas actually are embedded within some of the agrarian or traditional or indigenous cultures.
I think that you make a very good point. I mean, we have also, through our own work at Earth for All, realized that most of the economic thinking has predominantly been produced in the West, has not taken into consideration the needs or even the incredible wealth of knowledge and understanding of how human beings can interact with the environment and with nature from indigenous people. And so I think that this arrogance of the West, that we can actually predetermine what growth means and also put in place the models that are going to satisfy the real needs of people across the world is really a problem. Let's be very clear. I mean, I think that the positive coming out of the degrowth model is forcing us to optimize, to decouple, to come back to what is actually most essential. And again, we need to realize that part of the result of coming out of COVID was that people, and we've done a survey, 75% of GDP citizens want a well-being economy. They don't want to continue to grow ad nauseum. So I think this is really important.
Are these ideas gaining ground in policy and politics? Are they moving kind of more from the activist or academic margins to more of a policy mainstream?
I think it depends where. Clearly in some Western economies and in some Eastern, I mean, if we look at Bhutan, we know that we have the happiness index. As I said, we've got the well-being economies. In Europe, interestingly, and I just spent the morning here in Costa Rica on the phone with one of the members of the European Parliament who is actually putting forward new policy at the European level, which is very much focusing on shifting beyond GDP, addressing degrowth, addressing green growth, and also very much addressing well-being economics. And what's interesting is he has a multi-party. So at least in Europe, and we were with Caroline Lucas at the House of Lords in the UK as well, and this is also gaining some ground, even though obviously we heard Liz Truss and her replacements very much talking about growth, growth, growth as the only way to move forward. But clearly there is a movement which is starting to say, especially post-COVID, can we tap into that subconsciousness of people when we knew that we needed to go back to what was most essential, when we knew that actually surviving a pandemic, having good health care, making sure that our loved ones were safe was more important than material consumption. That, I think, is something that we really need to tap into and that some policymakers are very much thinking about.
Now, like its 50-year-old predecessor, the Earth for All actually does model 2 scenarios for the future. The too little, too late, and then the other one, which I believe is the giant leap. Do you want to talk a little bit about what those models are and what they're foretelling us about our future?
Too late scenario is one which very much says if we continue at the pace that we are now with the policy prescriptions that we have, we will actually continue to have temperature rise, which will be between 2.5, 3 degrees, even 4 degrees. We will not actually meet our well-being needs, because what will happen is that in our global social tension index, the social tension continues to rise, well-being continues to decrease, and actually we see very clearly that then we have those very strong social tipping points. We talk about social tipping points and inequalities that grow within countries, because we're seeing now, of course, as I said, that wealth distribution is not occurring. And we see growing inequality between the North and the South. So all of those tension points can become very explosive, leading to more war, leading to more conflict, leading also to more pandemics, and leading more to continued climate change. So the spiral is not a good one. Now, if we in exchange put in place our 5 turnarounds, which are going to cost us about 2 to 4% of GDP per annum, and those 5 turnarounds, as I said, were around poverty, inequality, and empowerment, food and energy. And we put in place the policy recommendations for those turnarounds, which are very clear and which I can also give you if you would like me to move into that direction, but which are very much looking specifically at what we can do in the area of poverty. For example, ensuring that we put in place a universal basic dividend, ensuring that we also have broader social distribution, that we start to really tax the rich. And by the way, a lot of people are talking about this. I mean, this is even a discussion at WEF, the World Economic Forum, so
Yes.
that we actually end poverty, so that low to middle income countries have reached about minimum income of a threshold of US dollars 15,000 per person. That we think about debt cancellation, and we put in place clear debt cancellation programs, which is now also being discussed at the IMF. And that we really look at special drawing rights. That's for poverty. But then in terms of inequality, that the wealthiest 10% should take no more than 40% of national incomes. And this would be something that we are already putting on the table now and having conversations with policymakers across the globe, that we would really truly legislate workers' rights and ensure the deep transformation through just transition funds and what we call the citizen funds and this universal basic dividend. But also, obviously, in case of empowerment, this needs to happen at the same time as we ensure, in particular in some low-income countries that have not enabled women and girls to be educated, that we provide education for girls and women, that we achieve gender equity in jobs and leadership. And on the food and energy front, it's really taking it to the next level. It's going beyond a lot of the proposals that we have on the table to maintain the industrial and agricultural system, for example, and go into regenerative. We would need to be regenerative and have 50% of our land really enabled through regenerative agricultural practices or sustainable practices by 2050. And obviously legislate across the food system to reduce waste, to reduce food loss, to better distribute so that the most poor and also those that are in the most unequal social fabric are able to have access to food. And then in terms of energy, well, I mean, it's pretty clear that we need to immediately phase out fossil energy. We need to completely shift from an extractive economy, and we're not on that pathway. So even though we say that 3 to 4% of GDP is what it's going to cost us, we know full well that the incumbents, the lack of political will in some ways is not enabling us to really capture that giant leap. And yet it is feasible. And that's what those two scenarios are demonstrating.
Now, given that the audience that will be viewing this interview is a mix of government policymakers, UN agency staff, academic civil society activists, all of whom work primarily in the health sector, what would be your short list of actions that they themselves should take to move us closer to this goal of an upgraded economic system that's built on creating well-being while living within planetary boundaries?
So before I start that, I wanted to make one remark, because coming back to the acceptability of our messages, when we came out, actually, the book, and since then, in the last 2 months, we've had 700 articles in 50 countries. We've sold out 4 times in Germany, and we've been on the bestseller nonfiction list in Germany as well for the last 3 months. Now, what I want to say is not just to pat myself on the back, or the other authors of this incredible book, but instead to indicate that this is the time. This is the era of change. What you wrote, what we've written, all of those warning signs are now culminating in everything that we have said. So we are faced now with the greatest crises, the polycrisis we've ever seen. Now, in that sense, I would hope that all of the audience feels it, embodies it, and understands that our systems are broken. That's the first point. Most of us now talk about a healthy planet and a healthy humanity. They go hand in hand. We need to get better at describing that the planetary ailments are becoming human ailments. We know the causal effect of pollution on the health of people. If we continue to grow in some of our major cities, we know what will be the cost to people. We can look at it from a mortality perspective all the way through the actual health perspective of what this will cost the health system. But we can see it now in so many other ways. The health system is bogged down with mental illness because people are actually not feeling very close anymore to the planet due to the way in which they engage with society today, which is so distant from their need. And so I actually think that we will increasingly get sicker as our planet gets sicker. And so for health professionals, for policymakers that are looking at what do we do now today in the 21st century that is linked to our health system, we need to think through the type of welfare system and health system that we are offering our people, because it is fundamentally linked to the way in which people will survive on this planet. And we need to think of the impacts and the causal loops between planetary degradation, between the material extraction, and the way in which that is impacting our economies and then our health. And finally, we need to address our addictions. And it's very interesting that actually soon there will be a new book by one of our members, Bob Constanza, who's a very well-known ecological economist, who is talking around the addiction that human beings have to growth and to consumption as a similar addiction that they have to smoking, that they have to drug use, that they have to alcoholism, and that we need to think through what are the therapies that will actually enable us to wean ourselves off that addiction in a similar way as through the health process we try, and the therapy process, we try to wean off those people that are addicted to what I've just named. So that circularity of thought, that circularity of understanding that it's all interrelated, the health of the environment as well as the health of people are inextricably linked.
Your book is really wonderfully inspiring because it's hopeful. And at this point in time, we need to embrace hopefulness or optimism as acts of political resistance to the toxic kind of systems that we've been living with that create these polycrises. And so on that note, Sandrine, I'd like to thank you very much for your time. and really commend the Club of Rome for its excellent work 50 years ago and today.
Thank you so much. And it was a pleasure having this discussion.